The urinary bladder is a hollow muscular organ located within the pelvic cavity, directly posterior to the pubic symphysis in both males and females. When the bladder is void or empty, it lies almost entirely within the true pelvis, below the level or inferior to the pelvic inlet or brim. When it fills, it is going to increase in volume and expand superiorly up into the falx or the greater pelvis, and then would be somewhat positioned superior to the pelvic inlet as it occupies part of the abdominal cavity. The bladder itself has a somewhat pyramidal shape, with the apex or tip of the pyramid directed anteriorly just superior to the pubic symphysis. As we move posteriorly from the apex, we reach the body of the urinary bladder, which is the majority of this organ. At the opposite end from the apex, we are going to see the fundus of the urinary bladder, the rounded portion located between the right and the left ureters. The inferior aspect of the bladder, the neck, acts like a funnel which is directed towards the opening of the internal urethral orifice. To better visualize the internal aspects of this organ, I'm going to hide the right wall of the organ so that we can see this internal cavity. The bladder itself serves to store urine, and urine is going to enter the bladder posteriorly via two ureteric orifices and exit the bladder via the internal urethral orifice. These three openings lie at the corners of a triangular region of the urinary bladder known as the urinary trigone, or just the trigone for short, with the two ureteric orifices located superiorly and the internal urethral orifice located inferiorly. If we look at the path of one of the ureters as it descends from the abdominal cavity down into the pelvic cavity, we can see it passes through the wall of the bladder at an angle. And this is going to be combined with the muscular wall of the organ itself, known as the detrusor muscle, to help prevent the backflow of urine back up into the ureters. So the angle of the ureter as it passes through the wall, combined with the detrusor muscle, is going to act like a valve or a one-way sphincter that is going to prevent the urine that has been deposited in the bladder from going back up to the kidneys or causing backup to those critical organs that help maintain homeostasis. Now, the detrusor muscle is a specialized type of smooth muscle that is only found here in the bladder, and it is going to allow for this transitional epithelium to expand while the organ is relaxed, but then it's also going to offer a degree of contractility and assist gravity when we need to void our bladder in the process of urination.